All right, Hazel, thank you for coming in today.
No worries.
My name's Julia and I'll be your audiologist. So we'll start by asking you a few questions and then we'll do some hearing tests and then finish by discussing the results and what we want to do from there. So how does that sound to you?
Sounds pretty good.
Okay, so it's going to take about 60 minutes. Do you have any questions before we start?
No, but can I ask them along the way?
Of course you can. Yep, anytime you have a question, just jump in and ask me. So we'll start with what brought you here today?
So I went to my local community centre and they had a hearing van with some audiologists there. So I went in for some testing and they said that I had some hearing loss and I'd failed the test.
Okay, sure. So did they describe the results to you?
No, they didn't. They just recommended that I come and see an audiologist in a clinic.
Yep, okay, all right. So do you think the results came as a surprise?
To be honest, no. I've probably noticed a slight decline over the last 10 years in my hearing.
Okay.
And yes, just haven't actually gone and had it tested.
Yep, that's fine. And do you find that there are situations where you're struggling with your hearing?
Yes, I do find on the telephone can be quite difficult. Speaking with my grandchildren is a bit of a difficulty, and I just find background noise in busy areas can be a little bit difficult with conversing with people.
Yep, okay.
Because of how much noise there is.
Yep, okay, sure. And when did this all become noticeable to you?
I think it probably was about 10 years ago.
About 10 years ago. Okay, yep. And is it worse in the left or the right, do you find?
Not particularly. I think it's probably about the same.
Yeah, it's about the same. All right. And do you ever experience any ringing in the ears?
Yes, have had some ringing in the ears. Yes.
In one ear or both?
Both.
Okay. And how long has that been going on for?
That's probably been about 10 years.
10 years? Okay, yep, so it's the same. And any spinning sensations do you ever get? That you're spinning around the world or the world's spinning around you?
No, I wouldn't say
No? Okay. And have you had any previous infections in the ears? Any trouble with your ears in the past?
Not recently.
No? You haven't had to visit an ear specialist?
No.
No? Okay. And have you ever had any history of noise exposure, maybe in any past jobs?
Yes, I was actually an air traffic controller for about 25 years.
Oh, interesting. Okay. So yeah, exposed to a bit of noise there.
Yes.
Yeah, okay. And are you still working in that job?
No, I retired 5 years ago.
Retired 5 years ago. Okay, yep. And what about any family history?
My father actually had pretty severe hearing loss.
Oh, okay.
He had some quite large
yes.
hearing aids, which, to be honest, probably deterred me from getting my hearing tested, as they were quite noticeable.
Yeah. Oh, yes. Well, it's actually in the past, 10 or 20 years, there's been serious improvements with the technology that we have and sort of improving every year. And hearing aids, I'll just quickly show you. They're actually these days only about this big. So these ones, they go behind the ear and these sort of sit right in. So yeah, you can see they're a bit different to the ones that your dad used to have.
They are very different.
Very different, yes. Quite small now. Anyway, I'll pop those away for now. Just thought I'd give you a little look. So before we start the testing, I always think it's important to identify areas that you're struggling with, which you already have, which is great. So I thought it would be good if we could sort of document these as goals, so then we can, as we go along, measure and see if there's any improvements in these situations. So what would you say would be the most important area that you would like to improve on with your hearing?
I think probably communication with my family and my grandchildren in person.
Okay.
I look after the grandkids a lot during the week, and I think sometimes my hearing loss can affect my ability to understand what they want.
Yeah, okay, sure. So would you say that a goal would be to converse with your grandchildren and not miss out on anything?
That would be correct.
That's correct. Okay, sure. Would there be something that you also find you'd like to put down as a goal?
I think the telephone one is
the
a big
telephone,
one.
yeah.
I do talk to my family and friends a lot on the telephone.
Yeah, yep.
Especially making plans to catch up and do activities, and sometimes I find myself repeating a lot and also having to ask for clarification quite often on what we're talking about.
Yeah, okay, all right. So you'd say that this goal would be to be able to talk on the telephone and be able to hear everything.
Mm-hmm.
Yeah, be able to hear better.
That sounds a good one.
Be able to hear
Hearing better on the telephone.
That's good, yes. Okay, sounds great. All right, would there be another one that you'd like to make note of?
The in public settings. So I find that I've actually been probably going to restaurants less as a result of the background noise. Because I find it difficult to focus on a conversation with all the noise in the background. Yeah,
okay, all right. So this would be, you would like to be able to go to a restaurant and be able to hear when there's a bit of background noise.
Yes.
Okay, great. All right, so we've got 3 so far. That's excellent. Was there anything else you'd want to...
I think they're probably the main 3.
They're the main ones. Okay, that's great. All right. So what we'll do now, we will go on to do some hearing tests. They'll take about 30 minutes.
Okay.
And then we'll go from there. So any questions so far?
No, I think it's all pretty well explained.
All right. Well, let's do some of the testing. All right, testing is all done. Thank you for being patient. I know it can take a little bit of time.
Yeah, no, it was all fine.
Yep, okay, that's good. All right, so we'll go on to discuss the results. So I have found that you do have a hearing loss, and it is the same in both ears. So basically, in the low pitch sounds, sort of deeper sounds, you have essentially normal hearing. And then as we move to the higher, sharper sounds, you do have a moderate loss in those sounds. So this is not uncommon for people who have had high exposure to noise, which you have had in your previous job. And then also as we get older, the first sounds to drop off are these high pitched sharp sounds. So these are sort of the sounds. And also you might notice, with sort of female voices or your grandkids, so
that resonates a bit.
So that's making
with my
sense.
hearing loss.
Yeah, okay, all right. So the good news is we did some speech testing, and it showed that with amplification, so by making the sounds louder, you actually got 95% of the words correct, which is great. Yeah, so I think it makes those sounds that you can't hear more audible, so you're able to recognise the words. So this actually makes you a great candidate for a hearing aid. So is that something that...
I think after seeing how small they are now...
that would be something that you're interested in.
That would be.
Okay, sure. All right, well, we do have a few different types of hearing aids. So we've got ones that, as I showed you before, so it would sit straight in the ear like that, or ones that sit behind. And I think that with the type of hearing loss that you have, and also your personal preference of it being a discrete hearing aid, I would actually recommend this one here. It's called a behind the ear hearing aid. So basically, I'll show you. You just pop it up behind the ear here, and then there's a thin little tube here, and you just pop that in, and it sits like that. So, and then your hair would cover it there. So,
it's very discreet.
Yeah. So, what I can do is order this hearing aid for you. They take about 2 weeks to come in. And then from there, come back in 2 weeks and we can fit the hearing aid and then go off and see how you go with it.
That'd be great.
Next time you come in, we'll make the appointment for 2 weeks. Feel free to bring someone along with you if that's something that you'd like to do.
Yeah, I think I might bring my older daughter. She might be able to help me with the management of the hearing aid.
Yeah, definitely. Yeah, well, that's fine if you bring her along. We'll go out the front and book your next appointment for you to come in and have the hearing aid fitted.
Thanks for all your help, Julia.
That's okay. Thanks for coming in today. Any questions before we go?
No, I think I'll probably think of some along the next 2 weeks, but
okay,
all good.
Great. All right.